comes to childbearing, what we all look forward to seeing is a mother and child happy together. And most people think normal delivery comes when a woman goes into labor room and push herself. But we have another method of child delivery, which is cesarean section. Most people also feels that have an impression that when a woman have CS, they are less of a woman, or there must be a complication that leads to her having a child through CS. And CS is a medical procedure where a woman is wheeled into the theater and an incision is made and a child is delivered. The mother is happy and everyone is happy. Today we bring to you a doctor that will shed a light into what cesarean section is, conditions that could warrant it, and every single thing you need to know about cesarean section. We have Dr. Please.
Okay, I'm Dr.
Introduce
DS Omeza.
I've been hearing DS. I want to know that the DS.
Okay, DS implement David Sunday
Okay.
Omeza. So, medical officer, the Kogi State Specialist Hospital.
Okay.
I've been working here for the past 3 years. I'm glad to be here this morning to come and throw some light into this important topic that is very important to society and sometimes can be very, very controversial as well. So, thank you.
Issue of reproductive health is a very touching story in many parts of the world, especially in Africa, where the requisite technology for child delivery is a bit inadequate, despite the brains that we have. Before we get too deep into the issue, can you quickly please tell us some of the issues that have been affecting human reproductive health in Nigeria or in Africa so far, particularly the women?
Okay, thank you very much for the question. Mainly, the problem we face is basically ignorance and sometimes also culture, where some women rather believe that the best way to deliver is through vagina. And then, like she actually stated earlier, they believe that if somebody had a CS, maybe the person is less of a woman. Some people will conjure some story that the baby born through CS is not a normal baby compared to the baby born through the. So basically, it's about ignorance and illiterate, and then the cultures among in our society that limit substantial amount of women from seeking this interventional surgery that could be of help to the baby and to the mother, so that at the end of the day, everybody can be happy. So again, also some people just feel that except they deliver like the popular phrase, the Hebrew women, so they're not yet there. So they want to feel that pain. They want, even when it's not, necessary. So that is it. Basically, it's about ignorance and culture that limits some number of women from.
How have these cultural problems affected maternal mortality in this country?
Of course, your guess is as good as mine, significantly, because it will definitely lead to an astronomical increase in maternal mortality. And that's why Nigeria rank very high in the worldwide among the countries that have the highest rate of maternal mortality, because of such ignorance that keep people at home, in prayer houses, in church, in mosques, and then at the end of the day, by the time they come to the hospital, it's almost at the point of death. So, and then they now say, "Oh, we took our mother to the hospital, and that's where she passed out." So, it's actually lead to an astronomical increase in such a very negative statistic.
Okay, doctor. We all know I've seen medical practitioners that will tell you their own idea of a Hebrew woman is a woman that delivers regardless of which way you delivered through, and your child is alive, the mother is alive. Now, can you help us to explain in the simplest form what CS is?
Okay, so thank you once again. Like you rightly said, the joy of doctors or the purpose of pregnancy is that at the end of the day, the baby is delivered alive, and then the mother and the baby, they're happy, and the family is what is happy. So irrespective of the method of delivery, what matters most is the end product of that process. So what is CS? CS is basically a surgery that is done through the abdomen to bring out the baby, the placenta, and all products of conception, so that everybody is happy at the end of the day. So it is basically, I call it a surgery of necessity. So it's a surgery done, like I said, through the abdomen to bring out the baby, the placenta, and every other product of conception. So that, of course, like I said, it's a surgery of necessity. So condition calls for it. When you cannot, it's not advisable for you to go through the usual vaginal delivery. So that's what's called cesarean section mainly.
Doctor, you talked about complication just now. So are there issues or problem or health issues that could necessitate for CS?
Yes. So the like you said earlier, that CS is actually a surgery that is done through the abdomen to bring the baby and the placenta and every other process of conception, so that the baby and the mother can be alive and healthy for their family. So there are indications. You don't just carry a woman and then take her into theater for surgery. So there are reasons that makes a doctor to advise on cesarean section. So number one, it could be because of the baby's health. So it could be from the baby fetal indication. It could be that the problem is between the mother and the baby. That's maternal fetal indication. So it could also be because of the placenta of the world or of the environment. So for example, you have the placenta issue. It could be placenta previa or placenta accusio. So if you have a placenta previa, the placenta of the baby is covering the outlet where the baby is supposed to come out. It's like, I want to go out now, then somebody went and blocked the road. I can't go out. So if I want to go out by force, we're going to go into fight. I injure myself, he injures himself as well. So the placenta is covering the outlet where the baby is supposed to come out. And then you know that the placenta is the connection between the baby and the mother. And then it's very, very bloody. That's where the blood flows and the oxygen, and then you get the food from there. So you don't want such a woman to go into labor because the baby cannot come out. And if the baby is trying to force the sweet to come out, when it started bleeding heavily, before you can intervene, you can lose the baby in the process. In fact, if not even the both of the mother and the baby. So placenta previa is another one reason that can cause it. So another one is what placenta accusio. For example, a woman can suddenly, maybe from trauma, maybe he fell down or he fought his husband, and then he kicked the woman in the abdomen, and then the placenta, suddenly detached from the baby. And then the doctors quickly, examined and then found out that baby is still alive. So within that short time, we need to quickly do the CS and bring out the baby alive. So another one that can that can cause a reason for CS, which is very, very common, is what we call what? CPD, cephalopelvic disproportion. Okay. For example, when there is a misalignment between the mother's body and the baby that is coming out. What do I mean? For example, now, maybe a woman has a small pelvis. The waist is too small that the baby cannot come out, or the baby is too big. What we call the macrosomic baby, especially the women that has diabetes in pregnancy. So the baby become big, so it cannot come out of that outlet. Again, it's either the baby is in the position of the baby is too bad. For example, the baby is supposed to be coming out with his or her head down. So if the baby is now lying transversely, there's no way it can come out. And then the baby is lying in an oblique position like this, so it cannot come out. So this is another reason that can make doctor to advise on CS. Another one is the issue of the mother himself. So whether the mother has some health implication, it could be kidney issue, it could be cardiac issue. For example, a woman has a heart failure and then she goes into labor. Already the heart failure is a problem, so you don't want such woman to undergo some stress that will put the baby and then her life in jeopardy. So these are, some of the issues that can make a doctor to now advise a woman to take the option of CS. Again, also, if another popular one is what the eclampsia and then the preeclampsia. This is another maternal factor. So preeclampsia, suddenly after the 20 weeks of pregnancy, it only happens from 20 weeks of pregnancy. Suddenly the BP of the pregnant woman suddenly become very high, around that kind of 140 over 90 millimeter of mercury, and then taking at about 4 hours interval, and then is still consistently around that kind of 140 over 90. And then suddenly the woman started having some visual disturbance, having some blurry vision. You take the urine, there are proteins in the urine. This is what's called preeclampsia. And if it's not quickly addressed, it can progress to the eclampsia, where the woman started convulsing rigorously. And in such a case, there is only one definite solution, CS, or just bring the baby out. And it works in a magic way. Once the baby is out, everything suddenly disappear within 24 hours or so, and then the mother is alive, and then the baby is also alive and happy. So one of the commonest things that can also cause that is this eclampsia or pre-eclampsia. So once a doctor identifies that, you come to the hospital, you take your BP, you examine your urine, and then you can go advice on it. Another one is maybe an older primary gravida. For example, you're a woman for the very first time, you're getting pregnant, and then you're 37 or 38 years. So doctors want to advise you to do what? CS. So that you not subject that baby to the stress of labor. That such a baby is a precious baby. That 8 years or for 35 years, you're getting pregnant for the very first time. Also, if you have had a long history of infertility, you got married for about 10 years, there's no baby, there's no pregnancy. Suddenly you get pregnant. You don't want to subject that baby to the stress of labor. So, but the commonest cases that can result to CS in the hospital, number one, fetal distress. The baby head as well. Suddenly, the doctor found out that the baby's head is in jeopardy. The heart rate suddenly become increasing. So we need to bring that baby out for his or her survival. Remember, we say CS is done so that the baby and the mother can be alive. So another one is the one I talked about just now, the cephalopelvic disproportion, when there is a misalignment between the mother's body and the baby. And then another one is what? Maybe a repeat CS. Of course, if you have done CS before, you can also be advised to take another CS, because already the womb has been tampered with. So we don't want you to go through the process of labor that may rupture the womb and they will now result into a serious case in the hospital.
Is it possible for a woman that has gone through cesarean section to subsequently give birth on the natural way?
On her own? Yes, it's possible, especially after the first CS. If for the very first time a woman had the CS done, in second pregnancy, yes, it can be allowed, it can be tried to undergo a normal vaginal delivery. We call it VBAC, that's vaginal birth after cesarean section. And that is, before a woman can be advised in such a way, we have determined that what causes the previous surgery is not a recurrent case.
It's no longer a factor.
It's only a factor. So, for example, now, if a woman at the age of 14 years got pregnant, there's teenage pregnancy, so got pregnant. So the waist, the pelvis is small.
Tiny.
So tiny, then the baby cannot come out. At that time, maybe you do CS. Maybe the next pregnancy, the lady has now grown to be 18 years or 20 or 25 years. And that time, maybe the pelvis has now what? Enlarged. So you can also, okay, let's try the lady. Or maybe at the first pregnancy, it was just because the baby was not properly positioned. In the second pregnancy, the baby can be positioned well, and then you can try the person. But once, of course, even at that time, it is advisable to be tried in the hospital where doctors are available, so that if there should be need again to quickly intervene, it can be helped. Not that you are at home and then you are doing it by yourself, and then by the time maybe the labor is not progressing, and then before you go rush to the hospital, what was not supposed to happen has suddenly happened. But once a woman has had 2 or 3 CS, it is no longer advisable to go into any natural.
Okay, I'm glad you mentioned the 2 or 3 CS so that we will not get it all mixed up. Some people would say, oh, doctor said after CS I can still give birth. After the first, second CS, you can't have a natural birth again. That's what the doctor is saying. Now, doctor, a few weeks ago, I think we had, we read online Social media is where we get our information from. Now, most of our information. We read online of a woman that died because the husband did not sign her consent form. Medically, can a woman sign her own consent form?
Okay. Yes, medically you can sign your own consent form. There are criteria for you to be able to sign your consent form by yourself. Not even just in CS, in any form of operation. Or medical
emergencies
that you are doing. Number one, are you of age? So once you are 18 years and above, you can sign. Secondly, are you mentally stable and capable? So I hope the person is not you not have any psychiatric this thing. So he's able to comprehend the surgery, the procedure, the likely
complications.
So once that has been explained to her or him, and she is in a good state of mind, she or him can sign a consent for himself for any surgical procedure. But the problem is that in our setting, number one, ignorance. Secondly, sometimes women don't have money for such a procedure, and then when they come, so they need to wait for the husband or the family, and then who now have a very stiff hand, and then does not want to do. And then of course, if you and your husband have not been able to come together and have an agreement and sign, doctor cannot just come and hijack you and take you to the theater to go and do surgery. So sometimes it's basically because of that. So, but yes, once you are above 18 years of age, you are mentally capable, you can understand and comprehend the procedure about being done on you, and you have the finance, you can sign for yourself. I have signed for myself before. I had surgery before, just a minor surgery, but I signed for myself and then it was done.
As a medical doctor, is there a situation, whether this man signs or not, the life of this woman and her baby is more important? That is on the issue of CS.
Yes, there are cases like that, extreme cases like that, not even just in CS alone, where a doctor will have to act by law to save the patient. But of course, before you do that, you also, as a doctor, you also have to involve the hospital where you are working, hospital management, and then perhaps, if it's possible, report to the security agency so that you can go. So that, because you can't just do things on your own, and then at the end of the day, the person you want to help, and you land you in court, you're going to be sweating. Yes, there are cases like that where you have to act. Based on the fact that you want to save the mother, you want to save the child. But of course, it is an extreme case, and then where you have to take an extreme decision, and then you have to inform the hospital management to be aware, because everybody need to know that, okay, this is the last resort now, since the person who need to sign has refused signature. So
it's not available.
It's not available. So the hospital now take it upon him themselves and provide a support for the patient, just to save the babies and
okay, doctor, let's talk about elective CS.
Okay.
We have people that walk into the hospital and say, okay, I want to have my child. Is it usually accepted?
Yes, it's possible. In fact, CS generally is just, okay, there are two types of CS. It could be elective or emergency. Elective is about 10 to 15%. In most cases, CS are 90% of cases of emergency. They are always rushing to the cause of emergency. So elective cases, it's either you are booked that, okay, this woman has been coming to the clinic, we've seen the patient, we know he has a condition, so they prepare you ahead that they're going to have elective CS. But there are some women like last year that say, okay, so I don't want the pain of normal labor. I just want to have my baby through CS and go.
And
so if you come and then you opt for it, then of course that's all, it can be done. There's not any restriction on that. So a few women usually come and say, I choose CS as a method of delivery.
Thank you very much, doctor. Lastly, can you tell our viewers that there is no shame in having CS?
Yes.
The stereotype is needless.
Yes. Categorically, there is no shame in having CS, and there is no glory in undergoing what we call the Hebrew women type of delivery. What matters most in pregnancy is that at the end of the 9 months, or whichever month it is, the mother is alive, baby is alive, everyone is happy and everyone is healthy, irrespective of the method of delivery. And then you are not going to be the president of the country simply because you are delivered via vaginal delivery. It's not, the method of delivery does not determine your future, your destiny. No. It has nothing to do with that at all. So
thank you.
What matters most is bring out the baby alive, and then everyone is healthy.
Thank you so much.
Thank
if you are
you
a CS mother, your child that you gave birth through CS and the one that someone else gives birth to through vaginal delivery, there is no difference. Your child is beautiful. You are a strong woman, and there is absolutely nothing wrong with you. Don't be ashamed to speak out. Some people want to talk about it, but they don't want to talk about it. And you telling someone, okay, I had this complication and I went through CS, may help someone else. The most important thing is that you have your child, you are happy, and everyone is happy. Have a nice day.